everyone, welcome to Try Right. This is Pack 365, myself Srija. So today you are going to learn about the isolated and classification of diseases of the respiratory system. So in this slide you are going to learn about the pneumoconiasis. So what do you mean by pneumoconiasis? These are the lung disease caused by breathing in harmful dust particles for a long time. So whenever you breathe the harmful dust particles for a long time, so what happens next? The dust gets trapped in the lungs and they causes the inflammation and scarring. So this results in pneumoconiasis. So what is the J63 code description? It's pneumoconiasis due to other inorganic dust. That means lung damage from the inorganic dust. So pneumoconiasis means it's a lung damage due to the inorganic dust. So what do you mean by inorganic dust? It's not containing the carbon. So material which is not containing the carbon is called as inorganic dust. So what is the example of J63? It's J63.1 bauxite fibrosis. So what do you mean by bauxite fibrosis? It is caused by inhaling the bauxite dust used in aluminium industries. So here in the right side you can see the picture of pneumoconiasis. You can clearly see the dust in the alveoli, how the dust clogged the pores in the alveoli, resulting in the condition. So coming to next code J64, it's unspecified pneumoconiasis. So whenever the exact type of the dust is not known, then J64 code is assigned. So it is simply written as J64. So they do not specify whether it is an inorganic dust or organic dust or carbon dust or cotton dust. So you can assign the code J64 directly. So next code J65. It's pneumoconiasis associated with the tuberculosis. So in this code description, you can see two conditions which are related. So which are associated with each other. So when someone has both tuberculosis and pneumoconiasis together, you can assign the code J65. So this combination can make the breathing problems more worse, right? Because both are lung infecting tissues, lung infecting disease, right? So this combination make breathing problem more worst. So next code J66. It's an airway disease due to specific organic dust. Organic dust is nothing but which we obtain from plants, cotton, etc. So here the lung disease caused by the organic dust. For example, biocinosis. So what do you mean by biocinosis? It's also known as the cotton workers lung, which is caused by the cotton dust. So people who work in the cotton industry or cotton factory can experience this biocinosis. So whenever cotton dust is diagnosed, you can give the code J66.0. So the next code J67, it's hypersensitivity pneumonitis due to organic dust. So what do you mean by hypersensitivity pneumonitis? It's an allergic reaction in the lungs due to breathing in moldy or organic dust. So whenever the allergy takes place in the lungs due to taking off the organic dust inside, so hypersensitivity takes place. So what will be the example of J67? It's J67.0. It's a farmer's lung which is caused by moldy hay exposure. And the next one, J68. It's a respiratory condition due to inhalation of the chemicals, gases, fumes, vapors, etc. So whenever breathing problems which are caused by chemical or gas exposure, J68 code must be assigned. So in the diagram, the top image shows dust particles entering the alveoli, that is air sacs, which is leading to pneumoconiasis. So whereas the bottom diagram, it compares the bronchitis and pneumonia symptoms. So both can result from dust or chemical exposure. So what are the symptoms of bronchitis? Sore throat, persistent cough, body aches, chills, shortness of breath, chest pain. Whereas pneumonia, fever, productive cough, fatigue, chills, shortness of breath and chest pain. These three symptoms are more common in both of the diseases. So what are the common symptoms? Chills, shortness of breath and chest pain. So coming to the next slide. J69 code. It's pneumonitis due to solids and liquids. This code describes that Pneumonitis means inflammation of the lungs which is caused by breathing in or taking in the solids and liquids. So what is the example? J69.0, pneumonitis due to food and vomit. So whenever food or vomit accidentally enters the lung instead of the stomach, it causes irritation and infection. So this results in the pneumonitis. And this is seen in patients with swallowing problems and also unconsciousness. So coming to next code, J70. It's a respiratory conditions due to other external agents. What does it mean? Lung problems caused by, whenever lung problems are caused by the external factors. So what are the external factors over here? They may be radiation or radio waves, and also maybe drugs. So for example, J70.1, it's a lung disease due to radiation. Chronic and other pulmonary manifestations due to radiation, nothing but lung disease due to radiation. So this is seen after the radiation therapy for the cancers. So what happens? The lung gets inflamed and also scared. So next, coming to the other diseases which are primarily affecting the interstitium. So what do you mean by interstitium? Interstitium you can find actually in the alveolar sac. So this is a supporting tissue which is in between the air sacs of the lungs. So what does this interstitium do? It usually causes the stiff lungs and difficulty in breathing. So let's look into description of the codes under interstitium. So J80, it's acute respiratory distress syndrome. So what do you mean by ARDS? It's a severe sudden lung failure where fluid leaks into the alveoli. So whenever the liquid fluid or the solid fluid, it enters into the alveoli, the lung failure happens. So that lungs, it cannot give enough oxygen to the blood. So in such cases, ARDS is diagnosed. So where it is seen in severe infections, trauma, and also the burns. Here in the picture, you can see the healthy alveoli versus unhealthy alveoli. Here there will be normal functioning of oxygen and air in the lung. Whereas in unhealthy alveoli, you can see less oxygen is supplied to the body and less air is present in the lungs. And also you can see the development of fluid in the alveolar sacs. So which results in forming of the pulmonary edema. So what is pulmonary edema? J81 code. It's a fluid buildup inside the lungs. So what is the example? J81.0. It is acute pulmonary edema. So this is often caused due to heart failure. So whenever heart, it cannot pump the blood properly, it causes to leak the fluid into the lung tissue, causing the edema. So next code, J82. It's pulmonary eosinophilia, not elsewhere classified. So pulmonary eosinophilia, what do you mean by pulmonary eosinophilia? The lung inflammation caused by an increase in the eosinophils. So whenever the eosinophils count is increased, eosinophils are nothing but it's a type of white blood cells, right? So whenever it is increased, you can see the inflammation in the lungs. So this causes the pulmonary eosinophilia. So what are the causes of pulmonary eosinophilia? Allergic reactions, infections, and also the certain drugs. So coming to next code, J84, other interstitial pulmonary diseases. So what do you mean by other interstitial pulmonary diseases? It's a group of diseases that cause the fibrosis of the lungs interstitial tissue. For example, J84.0, it describes alveolar and parieto-alveolar conditions. So what happens over here? The lungs become stiff and they're less able to expand, and you can experience the shortness of breath and dry cough. So this is about the ARDS, pulmonary edema, and eosinophilia. So next, coming to the suppurative and necrotic conditions of lower respiratory tract. So this slide, it explains from J85 to J86 codes and also from J90 to J94 codes. So this includes the diseases that cause the pus formation, tissue death, and also the fluid buildup in the lungs and pleura. So what do you mean by suppurative and necrotic conditions? So this involves the infection, pus, and sometimes the tissue death also in the lower respiratory tract. So What organs are there in the lower respiratory tract? Lungs, bronchi, and pleura. So this infections, it leads to pus formation, tissue death, and abscess in the lungs, bronchi, and pleura. So what does J84 code describes? Abscess of lung and mediastinum. So what does it mean? What do you mean by lung abscess? Lung abscess is nothing but it's a pocket of pus that forms inside the lung due to a severe infection. So whenever a severe infection takes place, there will be a pus formation, right? We usually observe in day-to-day life. So whenever we get hurt, whenever infection takes place, we can see the pus formation. So this abscess is a pocket of pus that forms inside the lung. So what do you mean by mediastinum? Mediastinum, it's a central area of the chest which contains the heart and major vessels. So this pus can collect over here also. So this causes the infections of abscess of lung and mediastinum. So what is the example? J85.0. What does it describe? Gangrene and necrosis of lung. So infection causes the parts of lung tissue to die and also form the pus cavities. So in simple words, the lung tissue becomes rotten due to infection forming pus. So next, coming to J86 code. So what it is? It's a pyothorax. Pyothorax is nothing but empyema. So what do you mean by empyema? It's a pus in the pleural cavity. The space between two layers is called as pleura, which is surrounding the lungs. So whenever the pus is formed in the pleural cavity, it is called as pyothorax, nothing but empyema. So for example, pyothorax with fistula. A fistula again means, what do you mean by fistula? A fistula means an abnormal passage between the pleural space and the another structure. You can see in the picture of here, at the right side, you can see the picture of pleural empyema. You can see in healthy lungs and how does the pyothorax lung look like. Here you can see a pus in the pleural cavity and the lung gets compressed. Also, a fistula means an abnormal passage between the pleural space and the another structure. So here the healthy lung, it shows clear yellow space, clear pleural space. Whereas the diseased lung, it shows the yellow pus in the space. So it compresses the lung, making it to breathing difficult. So what are the other diseases of the pleura? Pleural effusion. So what do you mean by pleura? It's a two thin membrane layer. One is visceral pleura and peritoneal pleura. So what is visceral pleura? It covers the lung surface. Whereas peritoneal pleura, it lines the inside of the chest wall. So the pleural space, it is between them, between these two layers. It contains a small amount of fluid for the smooth movement. So what is the example of pleural effusion? J90 code. So it is not elsewhere classified. It is just assigned as J90 because it's a standalone code. So next, coming to J91. It's pleural effusion in conditions classified elsewhere. So this slide, it explains the ICD-10 codes J91 to J94. So which are about pleural diseases. The problems affecting the pleura, the thin membranes that cover the lungs and line the chest wall. So first, understanding about the pleura, as I said in before slide, it has two layers, visceral and peritoneal. Visceral, it covers the lung surface, whereas peritoneal, it lines the chest wall. Here you can see the picture. This is the peritoneal and visceral, you can clearly see on the picture. So between this is the pleural space, which normally has a small amount of fluid for smooth breathing movements. So any air, fluid or abnormal thickening in this space can cause the diseases. So pleural effusion, the fluid collects between the pleura, but it happens because of the another disease. Here you are getting my point, right? The fluid actually collects between the pleura. But how does it happen? Because of another disease, because it is affecting from another disease, like there may be heart failure, cancer or infection. So this code, it is used whenever pleural effusion is a part of another condition. So coming to pleural plaques, you can clearly see here the plaque on parietal pleura over here in the picture. The yellow color one is the plaque on parietal pleura. So what do you mean by pleural plaque? It's a thickened or hardened areas on the pleura, usually caused by long-term exposure to asbestosis. So asbestosis is a mineral, right? So for example, J92.0, pleural plaque with presence of asbestosis. So how these plaques can be visible? They can be visible on chest x-rays and that does not cause any symptoms. So next code is J93, pneumothorax. So what do you mean by pneumothorax? Air leaks into the pleural space, so which is causing the part of the lung to collapse. For example, J93.0, it is a spontaneous tension pneumothorax. So what does you mean spontaneous tension pneumothorax? This tension, it means a pressure builds up so much, the pressure builds up so much inside the lungs, so which compresses the lung and heart. Actually, this is a medical emergency. Same like in the diagram, it shows air in the pleural space, making one lung collapse. So what are the symptoms of pneumothorax? It may be sudden sharp chest pain, it may be shortness of breath, and also the rapid breathing. So in simple words, air around the lungs makes it to collapse. So what is about J94? It is other pleural conditions. So what do you mean by it? So these pleural conditions or pleural problems, these are not covered in the previous codes. For example, J94.0, it is chylous effusion. Chyle means a milky fluid. Here the word chylous, in chylous, the chyle means it's a milky fluid which is rich in fat. It collects the pleural space due to damage in the lymphatic system. So this is about the pleural effusion and pleural plaques. So coming to the other diseases of the respiratory system. So what are the other diseases? They may be intraoperative and post-procedural complications and also the disorders of respiratory system not elsewhere classified. So in this slide, this covers the diseases and complications which are mainly the problems that happen during or after the medical or surgical procedures. Intraoperative means before surgery. Post-procedural means after surgery. So this code ranges, it mostly helps you to learn about the problems that are happening before and after the procedures. So these codes are used for lung or breathing related problems that don't fit into the earlier categories as what we have discussed. So what is J95 code description? It's intraoperative and post-procedural complications. So nothing but I said you like breathing complications that happen during or after the surgery or a medical procedure. So what does this do? This can happen even the surgery was not on the lungs. So what are the examples of such complications? They may be airway obstruction, pneumothorax, respiratory failure, and the other infection after the surgery. So what do you mean by airway obstruction? The blockage of air passage, right? Obstruction means blockage. So blockage of the air passage. Pneumothorax, air leak causing lung collapse. Here air will be leaked, it causes the lung to be collapsed. And then respiratory failure. And then infection after the surgery. So what are the example? J95.1. It's acute pulmonary insufficiency following the non-thoracic surgery. So it's nothing but this means the lung suddenly cannot exchange enough oxygen because a surgery was not on the chest. A surgery was not done on the chest. A surgery, it was not on the chest, it was done on another part. But the lung suddenly cannot exchange the enough oxygen due to this surgery. So leading to J96 code description. So whenever a respiratory failure is diagnosed, you can assign the code J96 and also J95.1. Respiratory failure is nothing but lungs cannot supply enough oxygen to the blood or it cannot remove the enough carbon dioxide from the blood to the body, outside of the body. So this respiratory failure, it can be acute and also the chronic. So what do you mean by acute? Short form. What do you mean by chronic? It's a long form, right? It's a long term. So for example, acute respiratory failure, given the code as J96.0. It is sudden failure of the breathing function. So coming to J96.01, it's acute respiratory failure with hypoxia. So what do you mean by hypoxia? Hypo means low, oxia means oxygen. So it has low oxygen content. That is hypoxia. The lungs fail to provide enough oxygen, leading to acute respiratory failure with hypoxia. So what are the symptoms over here? Shortness of breath, bluish skin, confusion, and also the tiredness. So when lungs stop working properly, causing the low oxygen or high carbon dioxide in the blood, so it's a medical emergency. You need to treat it as soon as earlier. So next coming to J96.1, which is chronic respiratory failure, nothing but a long-term lung failure. So this means the lungs cannot properly exchange the oxygen and carbon dioxide for a long time, right? So the person may always have the low oxygen or high carbon dioxide levels. For example, J96.10, it's a chronic respiratory failure, which is unspecified again. So when the cause is not given in the code description, you can assign the code J96.10. And next coming to J96.2, it's a combination of both acute and chronic respiratory failure. So this means the person has both sudden and long term, both acute and chronic problem with breathing or oxygen exchange. So this is worse than chronic alone because it causes a sudden worsening. So chronic respiratory failure is far more better than this combination failure. So whenever the acute and chronic respiratory failure is diagnosed within the patient record, you just assign the code J96.2. And when it's unspecified clearly or the cause is not specified, you just give the code J96.20. And next coming to J98 code. It is other respiratory disorders. So what do you mean by other respiratory disorders? This code groups includes other lungway or airway problems that are not listed elsewhere. So this causes affecting the airways, diaphragm, and also the lungs that don't fit in the other categories. So for example, pulmonary collapse. So what is mean by pulmonary collapse? Pulmonary means lung, right? So when the part of a lung collapse, it is also called as atelectasis. When lung collapse, it called as pulmonary collapse. So the last code of the respiratory system, J99, the respiratory disorders in diseases classified elsewhere. So these are the lung problems which are caused by other conditions. So other diseases. So what will be the other diseases? They might be autoimmune, they might be systemic diseases or systemic conditions or other acute or chronic related conditions. So the lung tissue here is always secondary to the another main disease. Here the lung is secondary and the main disease is the another disease which may affect on the lung. You got it right? So what will be the example of J99? J99.0. It's a rheumatoid lung disease. So what is rheumatoid lung disease? It's a lung problem caused by arthritis, means inflammation of the joints. So this is coded with the M05 category. So that is all for today's session, guys. In the next session, you will be learning about another anatomy and physiology of body system. Thank you.